Hi everyone, Dr. Nemechek here. I want there's this paper that came out recently, kind of a review paper, Leaky Gut Syndrome, Myths and Management. And they list these myths, and I'm going to go through them, and some of them I disagree with. And I want to just talk to you about that. So I'm just going to scroll down through here. So first myth, leaky gut syndrome is common and causes extra intestinal symptoms. So he's saying this is not the case, that it's uncommon. And so I completely disagree with this, and I would say many other researchers disagree with this. We are thinking leaky gut syndrome, in particular from bacterial overgrowth or SIBO, is quite common. And these overgrowing bacteria absolutely can cause symptoms outside of the intestinal tract. Okay, they cause anxiety, lightheadedness. That lightheadedness, low blood pressure can make you have headaches and just feel fatigued. The inflammatory reaction from leaky gut causes fibromyalgia, joint pain, muscular pain. You can trigger the mast cells around the small intestine with leaky gut, and people are getting hives, things like that. So they're way off base with this one. It causes time. Now, how do we know that those are from leaky gut? Well, we know when you use rifaximin, the only thing rifaximin can do is treat SIBO, bacterial overgrowth, and when you treat SIBO, the leaky gut stops, the inflammation stops, and tons of these symptoms will go away within, in some people within a week, 4 weeks. Okay, that's way too fast. If you have neurological symptoms like lightheadedness and headaches and brain fog, and that's from an injury, that's going to take several months to recover fully. Okay, so the fact you use rifaximin and get a quick response is a very strong indication that you have SIBO and that those symptoms were directly or indirectly related to the bacterial overgrowth and the leaky gut. Myth 2, leaky gut syndrome can develop because of stress or eating gluten. Here, I don't know about the gluten, but there is plenty of data that shows high level of emotional distress. Okay, abusive relationship, for instance, causes leaky gut and inflammation. Just that. Okay, so that is another way that happens, and that's well documented in the literature. Leaky gut is just a break in the gut lining. So there's basically two kinds of leaky gut. One is, so you have these cells lined up side to side. One is between the seam. Okay, we call that paracellular, and that seam area is called the tight junction. That's what happens when you have, say, SIBO. That's how that leaky gut happens. And then there's another type when you have very, very high levels of inflammation, and entire cells will die. You'll have a big gap. Okay, this happens with celiac disease, possibly Crohn's disease, severe inflammation, burns, multiple trauma, uncontrolled HIV infection, and COVID will do this. Okay, so I don't know about using the word break, but that's basically how the leaky gut occurs, the two forms. Here, myth, another one. Leaky gut can be confidently diagnosed by symptoms alone. Absolutely, they can. Okay, and so the tests we have for leaky gut, this breath test, okay, you can diagnose it in a research setting with a special endoscopy and all the special testing and stuff. It's very difficult, but you get a very accurate answer, and that's not generally available in the community. So people do this breath test. That's wrong 20-30% of the time. You get the wrong answer from this breath test. So what's the best test for leaky gut? Really? Well, symptom-wise, very common one is I eat this food and it gives me digestive symptoms. So people who say, particular, not like, oh, all foods do it to me, but like they'll say, oh, nightshades just mess me up, or citrus, or when I get SIBO, it's coffee and red wine bother me, all right? And so I do get symptoms there. When you have this particular symptoms, that's highly suggestive that you have SIBO and leaky gut, all right? And then when you treat that, it goes away. So I don't necessarily agree with this. Leaky gut syndrome can be diagnosed by blood work and standard endoscopy. Okay, I agree. It can't. It's very difficult to do. The tests we have aren't very accurate right now, and so the blood testing isn't of good utility. And then this next one is leaky gut can be diagnosed by stool studies. I completely agree. It cannot be diagnosed by stool studies. Okay, people doing this gene mapping of a rectal specimen. It doesn't tell you anything about what's going on in the small intestine. Okay, leaky gut can be cured by diet and probiotics. You have to think about what's causing leaky gut. All right, if you have that gap, okay, apoptotic leaky gut that's caused by COVID, a diet, meaning if you have a diet that's high in glutamine, so it have to be like a lot of sushi, okay, raw meat, or you just have add glutamine to your diet, yeah, that'll cure it for sure. You need glutamine to fix that. I agree, probiotics won't do it. You know, low carb doesn't do it. You know, all these, getting rid of nightshades doesn't do it. They won't heal the gut. Okay, you can change things in the diet so you have less symptoms from your leaky gut, but the leaky gut stays. All right. Nutritional supplements can cure leaky gut. As I said, when you have that gap, glutamine, it's well documented. Glutamine can fix that. Okay. I don't know of anything else though. Vitamin D, you know, zinc, a bunch of other stuff, or things that use to bust the biofilm. These products, I don't believe any of those can fix leaky gut. Medications cannot change intestinal permeability. This is wrong. So as I said, rifaximin, by getting rid of SIBO, which is a big cause of leaky gut, can improve your intestinal permeability. We also now know metformin, which is used to reduce insulin resistance, can reduce leaky gut fairly dramatically in the animal models, and the human data is starting to show that it can fix, reduce and stop leaky gut. And then the last one he has here is once leaky gut develops, it'll never go away. That's incorrect, as I've suggested with all these other things. So you can fix leaky gut, and you have to go after what maybe is driving it. Okay, so I hope that just reviewing all of that helps. And this is to me a sign where I'm just shocked at times when people go to a gastroenterologist and how they act like they've never heard of SIBO, they don't know about leaky gut, there's nothing you can do, and they're just very dismissive to the patients. And I think they need to read something other than golf or fishing journals or magazines. So everybody have a good day. Take care now. Bye.